Good afternoon. Great to see you all. Here we are with our health program from the Shura Council. My name is Dr. Zachariah Azar. I'm glad that you are here with us today. We had a couple of weeks that we took a break, and we're back now. Today is March 1st, and we're looking forward to the spring season coming up, and things are looking good in terms of COVID. Here in Southern California, the numbers have exponentially gone down. We have less hospitalizations. Vaccinations for the young kids have gone higher, and the numbers and the incidence rates have gone lower. So we're all happy about that, and we hope that you keep yourself and your family and your children protected. Today, we wanted to discuss a little bit about cancer. Cancer is something which is very prevalent in society, and a lot of people that we know, everyone knows someone that has gotten cancer or some form of cancer. And we wanted to discuss what are some risks and what we can do to try to prevent such a thing from happening. It's important for us to keep it in mind that we are living in a country which has better socioeconomic status and better access to healthcare. So therefore, if that is the case, we get better cancer care as well. So compared to lower socioeconomic societies and countries, second world or third world, the US and Western Europe have a better protocol in terms of cancer and better outcomes in general when you look at the papers. But living day to day, we hear about people that have cancer, and we see people and we hear about young people as well, women, men, children. uh, what we mostly hear is about breast cancer and forms of uterine cancer, lung cancer, colon cancer, these things that we have a lot of um, exposure to. So what we wanted to discuss is first the types of cancer that are out there, and then maybe get into a little bit of reason of why, since the last decade, this decade, the numbers have gone up. And we want to kind of decipher why is that happening and how has that happened. And then we want to discuss a little bit about what we can do to decrease the risk of cancer. That's very important because we can make simple lifestyle changes to actually decrease the risk of certain types of cancer in prevalent in society. So those are the things we want to kind of focus on. In a nutshell, we want to discuss the types of cancers that we have. The lymphomas. Lymphomas, as we know, is the blood cancers, right? There's different types of them. There are different classifications, but a lot of people we hear about, Hodgkin's lymphoma, non-Hodgkin's lymphoma. These are all blood cancers, cancers of the blood system, and usually we hear about that a lot, and that's in the news. And there's a lot of advanced treatments for it, and there's very successful treatments for these types of cancers. The other big one that we hear about a lot is breast cancer, because we have a lot of breast cancer awareness. There's lots of campaigns, and there's lots of screenings. And breast cancer is something that, if caught early, and it's not the aggressive type, you can survive and have a meaningful qualitative life. So that's something which is very important. Screening is key on that. And, females are the ones that get that mostly. Not so much you hear about brain cancers, tumors happening, mostly in the elderly and in the pediatric population as well. There are certain types of cancers that are um, sort of endemic to those populations. Um, we hear about them. If caught early and they're not aggressive, we have good outcomes with surgery as well as chemotherapy and radiation. Um, this is something which, there's leaps and bounds being made in terms of the advances in these treatments every day. There's research and there's continuing new discoveries and types of treatments that are more successful against these types of cancers. Of course, we also hear about kidney cancers. We get uh, cancers of the kidney, a lot of environmental toxins that can cause that, some genetic capabilities, some genetic possibilities as well. Some people are, they have certain genes that prone them to those types of cancers. And then in the elderly, we see a lot of elderly men we see with prostate cancer. That's something, as your age increases, the chances get higher and higher. So prostate health is something very important that senior men need to be paying attention to, specifically, the types of proteins they consume, the types of chemicals that they're near. We need to kind of protect ourselves from that. And then, of course, there's colon cancers. People have colonoscopies. I think after the age of 50, they're recommended every 3 years, if I'm not mistaken. And then if there's nothing, then they leave it for 10 years. But if they find a polyp or anything, then you repeat it again. So, colon cancer is one of the big ones that's prevalent. And that's something with screening and early detection, you can take care of it. It's not an issue. We do also have the other big one, which is lung cancer. Lung cancer among men, specifically in the last 2-3 decades, is very high. Now, with the advent of the smoking going down, the lung cancer also has kind of stabilized from that, and finally discovering and accepting that there was a causal relationship with smoking and lung cancer has actually, on the health spectrum, decreased lung cancer among men. Lung cancer, bone. Then you have the bone cancers, right? You have a lot of people with different types of sarcomas and different type of bone cancers. Usually, these are typically with a lot of exposure to some type of chemical or radiation or some type of environmental issue that has been persistent. That's something to be looked at and to be analyzed. And then also you have the bile duct, liver, and gallbladder. These cancers, which are a little bit more rare, but they do occur and they do happen. So these things are things that kind of keep us, informed into the classifications and the types of cancers. Now, each one has a different stage and grade. Your doctor, you know, a, 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 a patient might have a lump or a bump somewhere in the body. They might get worried that, oh, we don't want it to be a malignancy, which is something that can spread. It's malignant as opposed to benign, which is, oh, it's in its place. It's not increasing in shape. It's not changing. It's pretty much stable. There's a lot of benign lumps and bumps that people have in their body. So that's nothing to worry about, but you have to get it checked out. A lot of people will have fat deposits in their body, little bumps that are movable and soft. And those are fat deposits. You have to get that checked out by a primary care doctor. And if they think it's something serious, then they'll have it biopsied, or they'll take a piece of it out, send it to the lab. The lab will check it and tell you what types of cells there are, and if they have the tendency to grow. Are they aggressive, or are they very dormant and non-aggressive? So this is something to keep aware in terms of self-screening. And then, of course, you have the skin cancers, right? Skin cancer is very common in places where there's good weather and sunny. People are getting sunbathing a lot, they get suntans. These places, like if you check out Australia and California and Hawaii, and these places where people generally enjoy the weather and they're out and about and they're getting exposure a lot. That's some places where you have to do the skin screenings quite often. That's very important to keep that in mind, because your skin is the largest organ of the body, and your primary care doctor should be doing a skin screening for you, or refer you to the dermatologist so the dermatologist can do this screening in general. So that's very important. People might get, especially on the elderly people, that they have less hair. They get little growths. could be a melanoma from the too much exposure to the sun. So those need to be checked out, biopsied, and cut out. And that's something where your dermatologist can do that for you quite often. And if it progresses, then they'll do some type of surgery to take it out, or they'll burn it off or with a laser. So there's different options for people, but it's nothing to panic about. The key is to plan. Plan first, evaluate and screen yourself, and second, then you have to go ahead and execute a plan. Here we are in the midst of a pandemic. What has happened the last 2 years? All the screenings have gone down. So colonoscopies, mammograms, skin screenings, all these screenings have gone down because people have been reluctant to go to their doctor for most things. So if you're one of those people, it's now time for you to go back and get those screenings done, because you're behind the ball now. You want to get ahead of it, right? Depending on your age, talk to your doctor and say, do I have any cancer screenings that I need to get? Be very open, and you have to be, as I say quite often on this program, you have to be an advocate for your health with your doctor. The doctor is overwhelmed. They have multiple patients. They might forget to do something. You never know. They're human beings. But you need to be the advocate and say, hey, do I have any cancer screenings or diagnostic tests that I have to do? This is very important for them to check and for you to go ahead and do, depending on your age and your history and your genetics. It's very important to get the screenings done, and especially now to get caught up with the screenings. If you're 45 or above and with a relative that had cancer or colon cancer, then you need to go get assessed. It's important. It's something where you shouldn't keep it on the back burner. It's something which you should definitely try to get ahead of, which is, at the end of the day, it's going to improve the quality of your life and your experience in health in general. So that's very, very important, and that's something where it's in your hands, things that are in your hands that you can control. 15-20% of things are genetic, you can't control. What's going to happen is going to happen, but there's a lot of control that the individual has when it comes to their health. You have to be active and an advocate for your health so that you have the best experience with your optimal health. Right? You want optimal health. Everybody wants general optimal health. Optimal health is what? Optimal health is body and mind being in a functional, happy place. You don't want any aggravating issues in the body or mind. So that's very important to keep in mind. When it comes to cancer, screening is very important. Screening is important. Get your screenings done early, get them done on time. And if you have any elderly parents or relatives, get them to get their screenings done yearly or every 2 years or 3 years, whatever the recommendation is for that, they should do it, because that will keep them from experiencing worse things later on. That's very important to keep in mind. The other issue that we were discussing was lower socioeconomic status. Now that increases your cancer risk, right? Because you don't have access to healthcare, or you don't see your doctor in a regular manner. Then things get missed. Things get missed, and you don't see them quick enough. So you might have something growing that you haven't checked out. So it's important to do that. People that are regularly, at least once a year, going in for their yearly physical and checking out everything, they have a better quality of life in terms of their health, and a better experience in healthcare in general as well. So if you do your diagnostics, and if you do your screenings, you will have a better experience in health and with the medical system in general, right? That's my spiel on that. And then the other thing you can do in terms of some numbers that I wanted to discuss with you was that, between 2010 and 2015 and currently, there have been an increase. So I'll get you an idea. So between 2010 and 2015, the diagnosis per year about 18.7 million cancer diagnoses in the world, right? 18.7 million per year on average, right? The deaths that occurred from cancer per year, 8.2 million deaths. So that's a lot of people worldwide dying from cancer. Of course, majority of the deaths were in lower socioeconomic societies where they didn't have screening, they didn't have radiation, they didn't have surgical options for treatment. But still, that's a lot of people passing away from cancer. And this is something which is, for the most part, if it's not genetic, preventable if you get early screenings. And then now, 2019, numbers have significantly increased. It's yearly about 24 million cases diagnosed. 24 million cases diagnosed. And from that 24 million, 10 million die per year. So that's 10 million cancer deaths per year. That is, I mean, it's mind blowing, and it's something that we have to kind of get ahead of and think, why is this happening, and how is it happening, and what can we do to stabilize that number and decrease it? Things that, the risk factors. If you split it up, lung cancer 2.2 million, colon and rectal cancer 1.9 million, prostate 1.4 million, non-melanoma skin cancers 1.2 million, stomach cancers 1 million, and lung cancer causes 1.8 million deaths in the world still today. And that's mostly because most of the world still smokes. Most of the world still smokes. It's here in the U.S. and Western Europe. It's dropped a little bit. In the U.S., mostly it's dropped, but in Europe, people still smoke. It's very trendy and cool to smoke. And studies indicate that males more than females have a higher cancer mortality rate. So men will die more often from cancer than females. And among the men, the rate is highest among Black males, African Americans in the US, and lowest among Asians and Pacific Islanders. So that's something to keep in mind, and that goes back to lower socioeconomic status. The overall cancer mortality rate has been slowly decreasing over the last 30 years, but still we want to do reduce the number of people smoking worldwide. That'll definitely have an impact on the lung cancers. And then also, the addition of chemotherapy and radiation to surgery, that has decreased the number of deaths. So that's something which is very, very important to keep in mind. Okay. There's an increase in female breast cancers that they've noticed in the last 6 years, and that's a 0.5% increase. And the incidence of prostate cancer has remained stable. As people get older, males get older, they have a higher risk of getting prostate cancer. So that's that's something to keep in mind. And the CDC says that between 2020 and 2050, the numbers should stabilize in females and decrease in males. And the projection is that colorectal, prostate, female breast cancers, these things will rise, and diagnosis in older adults would increase because of the aging population in the West. So the more we're living longer, the higher the likelihood of more cancers caught at the senior level or higher. So that's something which is important. The other thing worth mentioning was kidney cancers. There was an uptick in kidney cancers for adolescents and young adults. That rate increased by 29% in that specific age group um, between the years of 1983 and 2015. So that's a trend that they have to kind of study and see what is causing that. It's very important. Of course, we discussed living longer. Aging is one reason why we see more cancers, because as people get older, you see higher cancers. And then, of course, nowadays we have an obesity epidemic. The obesity epidemic, obese people are more likely and at a higher risk for cancer than non-obese people. And then also the socioeconomic status, which directly affects your access to healthcare. If you have access to healthcare, you detect things earlier, you do better, and you get better outcomes, and vice versa, as you know. So those are things that are causing this. In terms of our lifestyle and diet, you know, lifestyle and diet, of course, the more plant-based you are, the less red meat you eat, or the less salami, bacon, sausage, hot dogs, processed meats you eat, the better off you are. Those are directly correlated to causing cancer, those types of meats. And then you have the red meats, which are group 2A, they call it 2A, beef, lamb, those of you who eat pork, uh, and doesn't include chicken or fish. Those things also put you at a probable cause, not a cause. Cause for sure, they say salami, smoked meats, bacon, sausage, hot dogs, anything of these things because of the nitrites. The nitrites are the causal relationship to cancer. Those are all group 1. They know that those things cause cancer. And then there's a group 2A of meats, right? Pork, beef, and lamb, probable cause of cancer. Then 2B, a possible cause of cancer. And then there's group 3 and group 4, and those are uh, those are categories which represent how likely something is to cause cancer in human beings. So these are the things that are important. Of course, leafy green vegetables are best for you. Those are very important to keep in mind. And then, in terms of chemical exposure, the less chemicals you're exposed to, the better it is in the long run for you. Um, your shampoos, your facial regimens, all these things that you utilize have chemicals. The more natural and less chemicals they have, the better it is for you in the long run. You don't want exogenous chemicals being absorbed by your body day in and day out in high levels. This will cause overgrowth of your cells, which will lead to cancer. You don't want that. Also, sun exposure, wearing SPF sunscreen when you go out in the sun for more than 20 minutes. And then the other new thing for young people is vaping. People vape instead of smoke and thinking that vaping is cool, but vaping also leads to nicotine addiction, um, mouth and throat irritation, coughing, wheezing, asthma, chest pain, raised blood pressure, upset stomach, nausea. All these things are associated with vaping, and vaping has chemicals as well that you're breathing into your lungs. So it's a big trend right now, but we'll see in years to come that vaping will also um, be a causative factor for cancers. So that's something to keep your children and the young people away from, if possible. It's become a very cool, trendy thing to do because they think they're vaping fruit flavors, but they have chemicals in them that are addicting. So that's something important to keep in mind. And then, treatments for cancer nowadays, they have a lot of immunotherapy. They have different types of therapies that are very, very, and they have stem cell therapy. They have stem cell implants that they do for blood cancers, which are very successful. They have the immunotherapy, which they train your immune cells to have anti-cancer cells or cancer killer cells, and they put that back into your blood system, and it kills the cancer. They do this at MD Anderson and all these other high, well-known cancer centers. So these things are out there. You have to research them. If you need any help or information, you can always text us or comment in the section, and we can get you help. If you have more interest in anything related to these types of cancers and how you can do better, let us know and we can help you. You can always give us some comments, and we'll respond to you. It's important, but in general, what you want to do is uh, maintain a healthy weight, lifestyle wise. Eat a balanced meal. Don't eat too much red meat, especially these barbecued meats that are, salamis and sausages and things that have nitrates. Stay away from those. Once in a while you have one, it's fine, but if you're having it consistently, it's not good for your body or for your children or for your elders. And then also, alcohol has a direct causal relationship to cancers as well as nicotine and smoking. So these things you need to keep away from. And then obesity, right? Maintaining a healthy weight is very important. That'll for overall health in general. And then do your screenings. Do your screenings on time. With COVID, everything has been kind of fallen back, but get back on it. Get back to your doctor. Ask them, say, what do I have to do for these screenings? Or if it's for your parents, ask them, what do they have to do? To get back and attend your medical appointments and get on top of everything. So if you can do that, then you'll be back on track, and your doctor won't miss anything. So it's very important to keep in mind. And that is it on cancer for today. I'm glad that you came and listened to us. And if you have any comments and questions, please don't hesitate to comment. We'll see you next week. And you guys have a wonderful week and stay healthy. Thank you. Take care.